Joining us today to speak about psychosis and Parkinson's disease is Dr. Gustavo Alva. He is the medical director of ATP Clinical Research in Costa Mesa and Anaheim, California. He collaborates with Pacific neuropsychiatric specialists in Orange County, and he's the assistant professor for the Department of Neuroscience at the University of California, Riverside. He is also a visiting professor in the Psychiatry International Program of the Universidad Autónoma de Guadalajara, UAG, School of Medicine in Jalisco, Mexico, as well as being a member of the volunteer faculty at the University of California, Irvine, Department of Psychiatry and Human Behavior. He has authored numerous articles on the subject of psychosis. He is a member of the American Board of Forensic Medicine, California Psychiatric Association, and the American Medical Association. Dr. Alva, psychosis is a mental illness affecting a portion of the population. What is it exactly?
Psychosis can include hallucinations and delusions, and I'm really happy that you asked that very question. Psychosis can come about from a lot of different things. Obviously, the main focus that we are addressing today is Parkinson's disease psychosis, in which individuals with Parkinson's disease can experience hallucinations and delusions. For the most part, most people would think of schizophrenia as the condition in which hallucinations or delusions would pop out. However, it's really important to note that Parkinson's disease affects about 1 million people in the United States, and the symptoms associated with it can be both motor and non-motor. Most people recognize Parkinson's disease as a movement disorder in which movement is slow. There's rigidity, slowness, stiffness, stooped gait, but they don't oftentimes recognize that there are non-motor symptoms associated with this condition. And with the non-motor symptoms, these can include things like constipation or impaired bladder control. They can also include depression, loss of mental sharpness or acuity, but probably one of the scariest things is experiencing hallucinations and delusions. That's what we call Parkinson's psychosis.
I see. And how is it treated?
The very first thing that people need to have is an awareness that this exists. And so one of the important things that we are trying to accomplish is through a storytelling campaign called Yours Truly. This is a multicultural storytelling campaign to bring greater awareness and understanding of the varied experiences of the non-motor symptoms that are associated with Parkinson's disease. So the best way of countering a problem is to be educated about it. Oftentimes, however, believe it or not, 1 out of 2 people with Parkinson's disease will develop psychosis, but oftentimes they're either embarrassed or they're scared about sharing the symptoms that they're experiencing, thinking that they might have something else beyond their Parkinson's disease. So what we are hoping to accomplish right now through this campaign and this website called yourstrulypdp.com is an opportunity for stories to be shared from the Parkinson's disease community to provide greater visibility as well as access to bilingual educational resources from advocacy organizations across the United States.
That is very interesting, and I'm sure very helpful. When was this program launched, and can you tell us a little bit more about it?
This program was launched late last year, and it's a collaboration between a pharmaceutical company called Acadia Pharmaceuticals and a nonprofit called StoryCorps. And through this alignment, there was this creation of weaving an opportunity of people to share their stories. As I made mention, the website, yourstrulypdp.com, is a great resource where people can go, listen to stories, share their own stories. And it's really interesting because when people share their stories, it's not only cathartic, it's helpful for them, but they help others as well. So a greater awareness will oftentimes help individuals seek out the help that they might not necessarily know is available out there for them. We know that Parkinson's disease is a progressive nervous system disorder. We know that the signs and symptoms vary greatly with people, but we also know that 1 out of 2 people will experience psychosis, meaning hallucinations and delusions. And oftentimes, the visits to the movement disorder specialist are honed in on the motor movements, but not necessarily earmarked around the non motor symptoms. So, this is an opportunity for people to be aware and to then advocate for themselves and get the attention that's needed for them.
So let's talk about Parkinson's disease. A lot of times, and the incidence of Parkinson's disease increases with age. It's estimated that 4% of people with PD are diagnosed before age 50. Can you talk a little bit about that? What are some of the early symptoms or early warning signs? And what's the progression?
That's an interesting question that you ask. Parkinson's disease is a neurodegenerative condition in which a section of the brain called the basal ganglia or the nigrostriatal area will become impacted, and there's too little dopamine. Obviously, that brings about specific motor abnormalities where people have tremors, they've got slow movements, and those are the obvious things that most people think about. However, even 20 years before a diagnosis is made, people can sometimes complain of constipation, bladder problems, depression, excessive daytime sleepiness, abnormal dreams. And these are all things that are tied in, but probably one of the scariest things would be experiencing hallucinations. Imagine you start seeing things and you mistake, say, a tree for an animal, or you hear things that aren't there, or you feel things, smell things, taste things that aren't there, or you start having these unusual thoughts that people are plotting against you, conspiring against you, stealing from you, or maybe even your spouse is being unfaithful to you. These can be really disconcerting and scary symptoms. And that's where it's important for us to be aware of the fact that these non motor symptoms are oftentimes not necessarily captured early on. And so the neat thing of what we're talking about is that yours truly is a national program that centers on the power of storytelling to increase understanding of these non-motor symptoms that are associated with Parkinson's disease. And by recording stories and highlighting shared experiences, the goal of this program, yours truly, is to provide a unique forum to elevate the patient as well as the caregiver voice and empower people to seek the support that they need.
I'm listening to this and I'm experiencing some of these things that you just spoke about, the hallucinations or perhaps these thoughts that are not like the normal thoughts, right? Which make me worry about my state of mind. But I don't have Parkinson's disease. I have not been diagnosed. So what would you suggest or recommend to the person who starts to think about, well, I'm kind of experiencing those symptoms? What would be the next step, basically?
That is an excellent question. Whenever in doubt, we should always seek out medical help. So, seeking out a professional within the medical profession is always the best move. A healthy brain should not hallucinate. And there are different causes for hallucinations and or delusions. Obviously, when we speak about Parkinson's disease psychosis, these are individuals that have already been diagnosed with Parkinson's disease and have had Parkinson's for a while. After developing Parkinson's, if they start having hallucinations and or delusions, then obviously that would be Parkinson's psychosis. Hallucinations and delusions can come about from different things, including schizophrenia or even, again, infection, different types of medication interactions. So what is oftentimes called delirium. And distinguishing between these things is very important, particularly in older individuals. Older individuals may experience depression, delirium, or dementia, and these are things that should be ruled out. But what we're speaking about predominantly is individuals that have already been diagnosed with Parkinson's disease and then subsequently develop psychosis, meaning hallucinations and or delusions.
Dr. Alva, anything that you would like me to ask you that we haven't covered that you feel is
Yes,
important?
there are effective treatments to counter Parkinson's disease psychosis. And that's where it's so important for individuals to seek out medical help. So, going to one's doctor and then potentially being referred to either a movement disorder specialist or someone else that specializes in this particular area can be get individuals the aid that they need. Sometimes, however, people don't necessarily know that these two things are linked, the psychosis and the Parkinson's. And so that's where it's very important for people to advocate for themselves. It's very important that we reduce the stigma associated with conditions like Parkinson's psychosis, particularly within our Hispanic community. So I happen to be a bilingual, bicultural doctor. And I work across different cultures. And I believe that sharing personal stories about loved ones may increase awareness of the symptoms without necessarily bringing about embarrassment, shame to the family, or adding to stigma. That is one of the things that we really need to combat. In addition to that, within our Hispanic community, there's oftentimes been a lack of resources. And one of the beauties about this website that I described earlier, yours truly, pdp.com, is that it offers a depository of educational resources that are bilingual and opens now the door, not just to our Caucasian patients, but certainly also our Hispanic community.
Are the stories there bilingual? Are they in English and Spanish?
Yes, the stories that are found in yours truly, pdp.com, are both in English and in Spanish, as are the educational resources, both in English as well as Spanish. So it truly is a beautiful collaboration, right? It's different advocacy groups from around the US. You described earlier that people that are older are affected, but we can all think of someone like Michael J. Fox, who was affected by Parkinson's disease at a very young age. So that's not something that we don't run into. Yes, typically individuals over the age of 65 will be affected with Parkinson's disease at a greater rate than younger patients, but this is an illness that can affect people even at a younger age. And especially within our Hispanic community, it's important to not hide things. And it's important to voice what concerns exist. And it's important to seek out help when help is needed.